We know from past experience and research that in outbreak situations, people have health issues because of the virus, but also more people have health issues and complications because of the secondary effects of the outbreak. So in the current pandemic, people are dying because of coronavirus itself. But if the pandemic and the response to the pandemic lead to the disruption of health services, then more people are going to die from other causes as well. So in our study, we looked at the potential for additional deaths among pregnant women and young children. And we modeled 3 different scenarios looking forward of different severity. In our worst case scenario, we saw that up to 60,000 maternal deaths and up to about 1.1 million children could also die. In general, I think we see 2 ways in which these secondary effects of the pandemic could impact children. So the first way is, as I said, around health service disruption. So, ordinarily, if a family has a young child that's sick, they may go and seek care from a health facility and get care. So if they have malaria, might get antimalarials or antibiotic for a cough or pneumonia. But under the pandemic, perhaps people are not able to travel to a health facility, or they might be disinclined to go. Perhaps they're afraid of going to health services. And also, even if they were to get to a health facility, perhaps at the facility there's now maybe fewer health workers because some health workers have been diverted to work on the COVID response, or maybe health workers themselves are sick, or perhaps at the facility there's not the necessary treatment, drugs, medicine, because of issues to do with the supply chain. Health facilities just now not having the drugs that they need. So that's the first general way in which we see this happening. And another big general way that we see, particularly for child mortality, is an issue that was touched upon in your previous segment, which is the potential for increased undernutrition, malnutrition, because of broader macroeconomic effects. So, for example, households now not having the same income that they had, disruptions to food services, people not being able to access markets and get the necessary food for their children. And what comes from that is that we're going to see more families living in food insecurity and potentially more children being wasted, so being undernourished. And while wasting itself doesn't necessarily kill many kids, what it does do is it increases the likelihood that a child will die from other diseases, other infectious diseases. And in our model, that second pathway, these broader effects, increasing food insecurity, increasing undernutrition, is also a big potential way in which more children are going to die because of the pandemic.